understanding ear infections in children, symptoms, homeopathic remedies, and natural management techniques. Ear infections are a common ailment in children, with otitis media being the most prevalent type. These infections often affect the middle ear and can cause considerable discomfort and potential hearing issues if not addressed promptly. The ear comprises three main parts: the outer, middle, and inner ear. Infections typically occur in the middle ear, where fluid buildup encourages bacterial or viral growth. Understanding this anatomy helps in diagnosing and treating the condition effectively. Various factors contribute to the onset of ear infections in children, with bacteria and viruses being the primary culprits. These microorganisms can enter the middle ear and proliferate, leading to inflammation and pain. Children are especially susceptible to ear infections due to their shorter and more horizontal eustachian tubes, which can easily retain fluids. Environmental factors like exposure to smoke or high pollution and allergies also increase the risk of developing these infections. The typical signs of an ear infection in children include ear pain, difficulty sleeping, fever, and hearing loss. Recognizing these symptoms early can lead to quicker treatment and reduced discomfort for the child. Recognizing ear pain in young children who cannot speak yet can be challenging. Look for signs like frequent tugging at the ears, excessive crying, trouble sleeping, and irritability. Fever and fluid draining from the ear may also indicate an infection. Untreated ear infections can lead to serious complications, including hearing loss, speech delays, and more severe infections like mastocytitis. It's crucial to diagnose and treat ear infections early to prevent these potentially long-term issues. At the doctor's office, diagnosing an ear infection typically involves a visual examination of the ear using an otoscope. This tool allows the doctor to see the eardrum and determine if there is inflammation or fluid buildup, which are indicative of an infection. Traditional treatments for ear infections in children often involve antibiotics. These medications can be effective in bacterial cases, but are unnecessary for viral infections. It's important to use antibiotics judiciously to avoid resistance and other side effects. Homeopathy offers a different approach by using natural substances in minute amounts to stimulate the body's self-healing response. The principles of homeopathy focus on individualized treatment, aiming to treat the underlying cause of symptoms rather than just the symptoms themselves. Homeopathy views ear infections in children as an imbalance within the body's vital force, rather than just a localized problem. It aims to treat the whole person, enhancing the body's natural healing abilities and strengthening the immune system to prevent future episodes. Commonly used homeopathic remedies for ear infections include belladonna for sudden onset of symptoms, pulsatilla for cases with thick, yellow discharge, and chamomilla for pain that is worse at night. Each remedy is chosen based on the child's specific symptoms and overall temperament. Administering homeopathic remedies to children involves dispensing tiny, often sweet-tasting pellets or liquid drops. These are usually well accepted by children, making them easy to administer without the resistance often encountered with conventional medicines' flavors and textures. Preventative measures are crucial in avoiding ear infections in children. Regular hand washing and avoiding smoke exposure can significantly reduce the risk. Breastfeeding also provides vital antibodies that help strengthen a child's immune defense against infections. Boosting a child's immune system naturally enhances their resistance to ear infections. Incorporating foods rich in vitamin C and E, as well as zinc, can fortify their immune system. Regular physical activity and sufficient sleep also play an essential role in immune health. Diet and nutrition are fundamental in preventing ear infections. A balanced diet that includes fruits, vegetables, and whole grains supports overall health and immunity. Limiting processed foods and sugars is equally important, as these can suppress immune function. When symptoms of ear infections persist despite homeopathic treatment, it is crucial to consult a healthcare professional. Persistent symptoms might indicate a more severe condition or the need for a different treatment approach, possibly incorporating conventional medicines alongside homeopathic remedies. Finding a qualified homeopathic practitioner is essential for the effective treatment of ear infections in children. Research certifications and experience, seeking recommendations from trusted sources or professional associations to ensure the practitioner is reputable and well-versed in pediatric homeopathy. In conclusion, homeopathy can be a valuable approach in managing ear infections in children. Its holistic nature and focus on individual symptoms can offer a gentle alternative to traditional methods, potentially reducing recurrence and promoting overall wellness in young patients. If you found this video helpful in understanding homeopathy and managing medical conditions, make sure to subscribe to my channel